Hello, everyone. Welcome to It's Sybil. I am Sybil Wilkes, and happy to have you all here today. A very important discussion, a conversation we're having today. As we are coming to the end of the month of May, I suspect many of you have already been made aware that May is Hypertension Awareness Month. And yay, we're number one. About 55% of Black adults have high blood pressure, which is hypertension, also known as hypertension or HBP. Black people also have disproportionately high rates of more severe high blood pressure, and it develops earlier in life. And there are historic and systemic factors that we can talk about. I do want to welcome in my co-host today, Dr. William Hicks, straight from the offices of Hicks and Hicks. I just always wanted to say that. But Dr. Hicks is a neurologist and specializing in vascular neurology. Dr. Hicks, welcome. Thank you so much for joining us today.
Appreciate you, Ms. Sybil, and I would call it Hicks, Hicks, and Hicks because there's three Hicks physicians in Columbus.
That is
So
that family business is strong, huh?
That's right. That's right. My dad, my sister.
That is awesome. That is so great. You specialize in conditions of the cerebrovascular system. What is that?
Blood vessels that feed the brain, essentially. And the most common condition is stroke, which is what is near and dear to a lot of people for all the wrong reasons. And that's a big reason why I got into the field of vascular neurology.
Was it an interest that was developed as a result of your studies, or was it a personal situation where you might have been affected, or a family member or friend might have been affected by strokes?
It wasn't a personal connection initially, but I knew that this condition robs people of their agency. It robs people of their ability to live and love life. And it doesn't always, it's not only what it does to an individual as
Mm-hmm.
far as potentially making them debilitated in some way or not
Right.
feel like their normal self. But obviously something worse can happen. Currently, it's the fifth leading cause of death in this country. It's the number one cause of disability. But it later in life, there became to be people very close to me, including my father-in-law. Before I actually met my wife, he had had a massive stroke. Was able to live for 10 years after that, but it gave me a front row seat into the impact that a severe stroke can have not only on the patient but also the patient's family. And so there is a ripple effect with stroke that it's very, very difficult to quantify unless you are experiencing it in a personal way.
Sure.
And it's exceedingly cruel. But thankfully, it's a treatable condition. It's becoming more and more treatable with each and every passing year. And that's the joy that I get out of my job, because when
Yeah.
I look back to how it was before with treatment, we have grown by leaps and bounds, but we still got a long way to go.
That's awesome. Are there two types of strokes, or is it more?
You got it right. There's essentially two types. It boils down, and I had this conversation with a patient earlier this morning when I was on call. There's a bleeding type of stroke, and that's called hemorrhagic stroke.
Mm-hmm.
These strokes are more rare. They're about 12 to 15% of all strokes around the country. Some parts of the country we call, some people call it the Bible Belt. In my line of work, we call it the stroke belt.
Mm.
It's because that hemorrhage, uh, cerebral hemorrhage or hemorrhagic bleeding stroke rate is much higher down in those regions than other regions of this country. But that's when a blood vessel bursts. And it caught, we know the adage pressure busts pipes. We've all heard that.
Mm-hmm.
And it's where a blood vessel bursts within the brain and it causes an oozing of blood into our brain. And we all know we're all hard headed,
Right.
so our skull doesn't move. So when all of a sudden blood is getting into the brain, it can cause a lot of problems. Like, you could just imagine what that could potentially do. The more common type of stroke is an ischemic stroke,
Mm-hmm. Mm-hmm.
aka a non-bleeding stroke. And this is where a blood vessel gets blocked for some reason. Either it gets clogged up from plaque or narrowing of a blood vessels over the years where just the flow doesn't get there anymore,
Mm-hmm.
or a clot can come from somewhere like the heart or somewhere else in the body, flick up into the blood vessels in the brain and land and suddenly cause what we call an embolic stroke. So
An
those are the two
embolic.
types. That's a much more common cause, the ischemic strokes, and therefore we have more treatment options for those. And the mortality rate, the chance of somebody being impacted with death or severe disability isn't as bad as these bleeding strokes present day. But we're working
Sure.
on that.
And you're making great progress and great strides in that, I believe.
Let's hope.
Overall, I believe you mentioned that stroke is the number five killer in the U.S. and the leading cause of serious and long-term disability. Now, the good news is the large majority of strokes are preventable and treatable, and so
Yes.
I hope that we'll talk about that as we go along today. We have a young woman who is going to join us, who many people know for her lovely and lively and just life affirming personality. Miss Juicy Baby. You may remember her from radio and The Little Women of Atlanta. Hello, Miss Juicy Baby. How are you?
Hey, how are you? God
I-
bless you.
God bless you. And how are you?
I am doing wonderful. I am blessed.
Yes, you are. Yes, you are. You just celebrated, if I can say that, or perhaps I should say, observed the 1 year anniversary in which you had a stroke, which was hard for a lot of people to believe, and there was a lot of concern because there wasn't a lot of information, and we all want to know what's going on. We want the tea. But can you take us back to that day and what happened?
I basically can tell you what was told to me.
Got it.
So I can tell you as far as I do remember, I was having a real bad migraine maybe a couple of days before, and that was it. I was going about my day like I normally do, and I was about to drive somewhere, but the migraine got so bad, I was like, let me just bag up and go lay down. But I was scared to lay down.
Oh, wow.
And so as soon as I got in the house, I called my next door neighbor.
Mm-hmm.
And as soon as I got open the door, I just collapsed right at the door.
Wow. But
I was able
something,
to get her on the phone.
yeah, something told you to call someone.
Hmm. Because the headache was that bad. I was like, I don't know what it is. I said, all I know, my head hurts really, really bad, and I am real tired.
Mm-hmm. And
And
and Dr. Hicks, is that one of the signs that perhaps we should look for in advance of a stroke, is having I guess a migraine like headache?
A lot of times it's the worst headache of somebody's life, and that can often be the trigger. A lot of migraineurs walk the earth, and the neurologists treat migraineurs all the time. So and even people that don't consider themselves migraineurs, they deal with headaches. But it's
Mm-hmm.
typically a headache that stops you in your tracks. It stops you and says something's different.
Mm-hmm.
And when it comes to stroke, again, not knowing Miss Juicy's the stroke etiology, but bleeding type of strokes tend to cause headaches suddenly because again it's a pipe bursting and it's introducing flow into a brain that doesn't have room for that sort of a thing.
Mm-hmm.
So that's often a quick triggering thing that a bleeding stroke could be going on. A headache can also be caused if the non-bleeding, if an ischemic type of stroke, if
Mm-hmm.
there's a large blood clot that hits a large area of the brain, it leads to swelling. And that swelling, even though it's not bleeding per se, the swelling that occurs when a stroke happens can it by itself cause headache in a relatively young or middle-aged individual who's dealing with stroke.
Well, I know Miss Juicy is too young for this, so but let's talk about because you did have the bleeding in the brain, right, Miss Juicy?
yes, I had a double brain bleed.
A double brain bleed.
A double brain bleed. They said it looked like it was some trauma to my head.
Mm.
They kept saying, "Did I hit anything?" And I was like, "No."
I see.
And so they said it looked from the look of it because I had some dried up blood on the brain, and they said it looked like I had a couple mini strokes before I had that big one,
I see.
and
I
didn't
see.
even know it.
I
And
see.
and mini strokes we've heard of. I know in my business, there's a wonderful woman who is a journalist in Chicago. Her name was Allison Payne, and she had to retire because she was having a series of mini strokes. Can you explain that as opposed to what would, I guess, mini as opposed to a major stroke, Doc?
So I think you got it. You know, there are occasions where people can have disruptions or changes in those blood vessels that are subtle, that can kind of take you off your game for a little while, and then you regain yourself. Because,
Mhm.
you know, the way to know the brain is to know God. A wise black neurosurgeon once said, Dr. Keith Black in Cedar Sinai. But you know, to just understand what the brain does, it is truly a miracle.
Mhm.
And that includes when a stroke can happen that is not a severe one. It can sometimes just allow a subtle symptom to come and go. And we always tell people that that's an emergency, whether or not it went away or not. Even if it went away, even if it only lasted for a few minutes, get to the hospital, because as Ms. Juicy mentioned, we may have been able to check and see, hey, has something been going on in the past? Is there some old areas of injury like she saw when she came into the hospital? Are we able to say, hey, why has this been going on? Let's look a little further. Even though a patient had a symptom that only lasted for 5 minutes or so and it went away, let's see what lies beneath. Let's see if there's an issue with her blood vessels. Let's see if there's an issue with the brain itself. Let's see if there's a heart related issue that's causing these subtle changes to happen in the brain. A lot of people use the term mini stroke, and then there's another term called TIA. And
Mhm.
TIA, it stands for transient ischemic attack, and that's just a fancy name for saying a stroke-like symptom that came and left, and it left without a trace on the brain scan. So but yet some people have stroke-like symptoms that come and go, and it does leave a stain on the brain. So neurologists, we look at these in different ways. We often treat them the same, we investigate them the same, but the ones that leave a stain, we call those strokes. And the ones that don't leave a stain, they typically last for a few minutes, and we call those TIAs, if that makes any sense.
Does that make sense to you, Ms. Juicy?
It rings a bell. They did say it was a TIA because they asked me, did I have any trauma to the head? And I didn't. But before like a month, that happened in April. So in January, I had a car accident,
Hmm.
and the airbags did come out.
Mm.
So that's the only thing I could think of, but I didn't know it was so minor. I didn't know if anything happened. It wasn't nothing like that happened. You know, I didn't know if I had a stroke or anything. And so I went on about my business like it wasn't nothing. Matter of fact, I came back to the house that same day I had a car accident and did a table read just like it wasn't nothing. And
Right.
then and
For
then
another
filmed.
project you were working on.
I sure did. And then filmed a movie the next day and everything. Like it.
That-
And then I told him while we was having a table read, after we took a little break, I said I was just in a car accident, and Carl Payne was like, I cannot believe. I wish everybody was dedicated like this. I said,
Right.
y'all wasn't gonna miss me on this.
While we have a break here, I just want to say, people who are just joining us, we're having a discussion today in partnership with our friends at the American Heart Association about strokes and hypertension. Hypertension Awareness Month is the month of May. Miss Juicy, in the month of May, is just a year past her having a stroke. The anniversary date, Miss Juicy, was April 28th.
April 29th,
April 29th. And so you felt something. You had this massive migraine. You knew enough not to continue your driving. You called your neighbor, and just to recap, and you got just into the door of your house and you collapsed. Do you
Yep.
remember anything that came after that, or this is all in the retelling?
That's all I remembered. I made it to the bathroom. I had got sick and everything, and I remember her coming over, and I said, "Here's my keys." She was like, "Call 911." I said, "No, I can't call 911. You call 911."
Mm-hmm.
Because I can't just leave my house vulnerable like this.
Right.
With me not knowing what's going on. So she called
You had the
911.
presence of mind at that
Yes.
point. Wow. Okay.
And then I just was like, I know not to let no strangers in my house, and I'm not too.
Right.
And so, and I was like, okay, you got my keys. Here's, I don't know. I dropped my phone. I was like, I don't know where my phone is. It's somewhere around here.
Mm-hmm.
And I was like, my mom, my sister number, and all this is in my phone.
And
Granted, this lady had never met my family before.
wow. But you
And
had enough of a relationship with her that you could call her and she would
right.
be there for you. And so you were in a coma for a period of time after this, right?
They said I was, but then the but then the ambulance, well, at first when they said I was, but then the ambulance said um I wasn't in a coma because he pressed my chest down real hard, and I got up trying to fight.
Mm. No, you weren't in a coma. I'm no doctor, but that doesn't sound like coma-like behavior, Doc.
Sternal rub, we call it. We often get patient. We tell the families to leave the room during a neurological exam in an ICU or in a critical setting, because it's not pretty. Because if someone's not looking like they're waking up, there's certain things we have to do to figure that out. It sounds like Miss Juicy learned the hard way.
So, Miss Juicy, and Doc, I'm just asking questions because I'm just curious that way. And
Sure.
if I'm not asking the right question, or if there's something you want to follow up with, please do. Miss Juicy, did you have a history of high blood pressure? Were you on medication?
Yes. I have I have a history of high blood pressure. My mom, my dad, and everything. So I was on high blood pressure medicine,
Mm-hmm.
and so
And
um,
and was it working for you? I mean, up to this point, were you did you have any other symptoms or anything like that that would indicate that the medicine wasn't doing its job?
it was controlled for a minute. For some reason, it got uncontrolled, and I didn't even know. And so,
So, Doc, if you are seemingly going along very well, after you are on blood pressure medication, do you recommend that you do like the song recommends, you cuff it, check it, uh, and meaning your blood pressure, and daily get your blood pressure checked?
Yes, we like to say in with the American Heart and American Stroke Association, know your numbers.
Mm-hmm.
And so that is something that we don't say know your numbers from 2018. We don't say know your numbers from when you went to Morehouse.
Mm-hmm.
It doesn't. We
Call
don't
out the
say,
house, Doc. I love
oh, come on. I mean,
that.
when I walk and I talk, I'm doing that.
Okay.
Uh, or Howard Med. I'm
Okay.
WHBCU.
Okay.
So,
Yes, you are.
but you don't just. A lot of people say, "Oh, my blood pressure's always been fine," or it was fine for a while, so I'm good. And then it's almost, people get this false sense of security. And I'm not saying this is Miss Juicy's situation, but just using this time to bring this point home, in that if you get to the point where your physician or your healthcare provider is happy with your blood pressure numbers, know your numbers. Top number, the systolic blood pressure number, less than 120.
Mm-hmm.
Years ago, like when I was in medical school, it was less than 140.
Mm.
And then when I was in my neurology training, or my stroke training, it was well less than 130. Now we're less than 120 because we're learning more about if the blood pressure is even sort of high, it can cause a lot of problems down the road to the tune of strokes, dementia, heart attacks, other types of vascular disease. So when I say know your numbers, that's what I mean. I had to get that part out.
Of
But
course.
a lot of people, they'll feel that, okay, I've seen my doctor and we got the blood pressure under control, prescribed some medications. She or he prescribed these medications, and I did a couple follow-ups and I was good. So then I'm good for forever. And then life happens, and maybe you miss that appointment. And then maybe you switch your job and the insurance changes.
Right.
And all of a sudden that medication is really expensive because the insurance got funky. And then you say, oh, well, I'm fine anyway. I'll figure that out later. And you say, you know what? That was back in the day when I was stressing and there was a lot going on. That's probably while it was up. That doc was trying to push meds on me. I'm good.
Mm-hmm.
I feel great. And then now it's a ticking time bomb because we don't know our numbers anymore. We have a thought that our numbers from 2019 are our numbers in 2023, and that may be true, it may not be, and that's gambling.
Mm-hmm.
And what our society has taught us is that in this country, we're not winning the gambling game when it comes to blood pressure and its negative effects. Half of our people have high blood pressure. Strokes occur in our people at an alarmingly high clip as opposed to others. And the driver of that is high blood pressure. And it's a treatable, it's a modifiable risk factor, as we call it. So we can do it. And it doesn't require a fancy vascular neurologist visit. It doesn't require you to say, oh, I live here and there's not too many vascular neurologists in this part of town. You don't need it. You need a primary care provider to have a good, engaging conversation with a patient as a human being,
Right.
Somebody who sees you and hears you and understands that, hey, you know what? Previous generations had high blood pressure, and there may have been various levels of trust within the healthcare community, just level of understanding with how the medical community deals with us as a people or deals with me as an individual. So there might be a lot going on there when you enter that office visit, or this might just be your first time. And then, maybe a family member had a stroke or had a heart attack. He said, yeah, my wife's been getting on me about that. Or, my husband's been telling me I need to get back in with the doctor. It's that the time to do it, but you do also have to understand that you need to feel comfortable when you're sitting down with that provider. And that's when the beauty happens. That's when you can maintain a great relationship for a long period of time outside of a hospital setting, outside of an emergency room setting, outside of a 911 setting. We all talk about, if there's an emergency like stroke, yes, we dial 911, but that shouldn't be like how you interact with the healthcare system.
Right.
You should never meet me.
Please God. So Miss Juicy, does that sound familiar to you? Did you have a relationship did you have a primary health provider that you had a relationship and that you had these discussions and perhaps took your blood pressure on the regular?
Yes, I did. Well, I did change since then, of course. And just like he said, I do have a better relationship with the one now because I'm not playing.
You're right. Good for
And
you.
plus, I have a machine here at the house too.
Mm-hmm.
I do check on a regular basis. I don't want to go through that ordeal no more because I literally lost my memory and everything.
Can you kind of take us through that? I know you said you were in the hospital for what, 4 to 6 weeks after the stroke. Is that right?
Yes, ma'am. I was in the hospital a month and 2 weeks. I had to learn how to walk, talk, and I couldn't even swallow. They wouldn't even let me have my Fiji water because I'm bougie. And so, they kept trying to give me some ice chips, I was like, I don't want this. I want my Fiji water.
Come on.
And the doctors said that they were scared that it would go down the wrong pipe
Oh.
and I get pneumonia.
Mm.
So I had to pass all kind of swallow tests before I could get anything, before I could even get Jello.
Mm-hmm.
And I'm a vegetarian. I was like, I don't want all this other stuff. But they wouldn't even let me have nothing
Right.
because I couldn't swallow it. But as soon as they gave me a walker and taught me how to walk on a walker, and then they gave me a cane. Then they gave me a wheelchair, and I started trying to run over people in the hospital.
So we might be on the path, but we don't want you to run folks over.
So, but soon as he said I couldn't have solid food, that was my cue to hurry up and get up out of that hospital.
Mm-hmm.
And so,
Does this sound familiar to you, Dr. Hicks?
Yeah, it's my everyday, basically.
Mm-hmm.
That's why I'm trying to hold back, because we often become the most hated person. You know, at first, you know, the doctor's here, he's
You're the
talking about a stroke.
savior.
You're the
Yeah.
savior. And then like day 2 comes around, or maybe, you know, towards the end of that visit in the emergency room or in the neurological ICU or our stroke unit, they'll say, "Hey doc, can I get something to eat?" And we say, you know, and we have to give them the spiel that Miss Juicy just eloquently explained. We no longer just allow that to happen. Back in the bad old days, we used to say, well, you know, doctors write the orders, and, you know, no one really bothered. And we didn't care for stroke patients in a holistic manner.
Mm-hmm.
We didn't quite understand what is harming them.
Right.
And what we learned, and this is actually, you know, historical data and research that happened through American Heart Association work with what we call Get With the Guidelines. And it's
Mm-hmm.
a way for all hospitals and stroke systems across the country to learn from each other,
right,
and figure out what are trends, how are certain stroke centers doing so well with patient survival, so patients could leave that ICU and go on to a regular hospital floor, leave that hospital floor, go on to rehab, and then eventually leave rehab and go on home and get some outpatient rehab. How do some people get that opportunity and other people languish in the ICU where they have a stroke and then 2 days later, all of a sudden there's a pneumonia? You know, there's a pneumonia and they're more, you know, their mentation goes way down. And now they can't move to the right side, they can't speak, and now they can barely wake up because there's an infection in their body on top
right,
of the stroke. We learned that it's that sort of stuff that would lead to patients passing away and not being able to leave the hospital. So during my time as a physician, stroke was the 3rd leading cause of death when I got my MD degree. When I got my medical degree from Howard, it was the 3rd leading cause of death. When I was in my neurology training, it became the 4th leading cause of death. And now it's the 5th leading cause of death. And that drop down is because we've gotten better about understanding, not only can we give treatments to prevent strokes, can we do procedures to remove clots from the brain, can we work with innovative research for high blood pressure related hemorrhages, but can we do something like don't feed Miss Juicy, who's here trying to recover from her stroke, don't feed her solid food when her swallowing system can't handle it.
The peristalsis. Yeah.
Well, yeah, and it's just the facial muscles to be able to swallow it and chew it, because it goes down the wrong pipe.
Like she said,
the
yeah.
windpipe, exactly.
Right.
So it's that small sort of stuff, moving patients around, making sure they don't get blood clots in their legs. I'm sure she had to get injections every day or a couple times a day that she just loved. I'm sure she did. and the reason why.
No, I did not love that. Not only did I get injections, but I was getting fed through a tube. The tube went down my nose to my throat.
Yep.
And and they put a tube in that was too big at first. So it started messing up my voice box. So they took it out. I had to have surgery and have it inserted in my stomach, have a peg,
feeding
inserted
tube.
in my stomach. So I had a hole in my stomach, the size of a quarter to hold the tube in. So that's how I was getting fed and getting fed the medicine that I couldn't swallow at the time.
Wow.
And so that, yes, sorry, Mr. Juicy.
Oh, go ahead.
Well, that again was keeping you alive and keeping you able to thrive because you were getting nourishment. Because before with stroke patients, again, we said, oh, we can't get anything by the mouth. Well, how are they going to get nourishment? Well, we'll give them some IV fluids. That's not enough. For someone to get through, for someone to get the brain back, for someone to get the muscles in the brain and the muscles talking to each other,
and the energy
you need
that
nourishment.
yeah,
Exactly. And so we now learn, over the years, we learn that, hey, getting nourishment in safely and in a way that she would be able to tolerate. This sounds terrible to anyone on this call, anyone listening. And it certainly was awful for Ms. Juicy. And when it came to the injections that she did not particularly enjoy, and no one would,
yeah.
but that's a necessary evil because it helps. It's a blood thinning medication that we give for patients hospitalized who can't mobilize the way they typically do. And what used to happen when we didn't do that with our stroke patients in the hospital, they get blood clots in the legs. And those blood clots would dissolve, they'd kind of break off, and now it's in their lungs. And now you can't breathe well. And that's, again, a way that a lot of our stroke patients didn't survive because they never left the hospital. So it's these kind of advancements with hospital care that allows Miss Juicy to celebrate her 1-year anniversary as opposed to something that we would never want to foresee.
Right. Miss Juicy, let me ask you something. As a diminutive person, you're a little person. Did your size matter, or were you told, or did you feel as though your size played a part in the way they treated you? Not, oh, you're a good patient, but in the way they medically treated you. Because you talked about the tube was too big and things like that. Were there other considerations they had to
I
make?
think they didn't take that in consideration as far as the tube. I felt like they should have took that in consideration and put a certain size tube in there. But they was just trying to. They said I have to say they said I was so irate when I came in because I didn't, like I said, I didn't even know who my mom and my sister was when they came to the hospital. I didn't know none of that.
Your memory was done.
It was gone. And so they said I was so irate. They were just trying to calm me down and get the tube and get my blood pressure down. They said my blood pressure had shot up over 200 and something. And then they had to, after they took me, the ambulance took me to one hospital. People found out I was there. They had to care flight me to another hospital to get me away from all of the riffraff. And
because those are your people.
Okay. Okay. And so plus they wanted to get me over to where the neurologist at that particular Wellstar, they said the best was out that one. So they took me out there. I don't even remember being on no helicopter. I don't remember none of that.
Wow.
I love that she's talking about what we call stroke systems of care. We're kind of learning through her story, all about how we treat stroke patients. And one thing I just want to highlight really quickly is that, and she said it perfectly, when she had to be life flighted out of there. Not every hospital is created the same when it comes to the approach to how we handle stroke patients. And like anything else in life, you have to know what you can't take care of. You got to know what your comfort. You got to know your comfort level with certain things. And unfortunately, and we're doing a lot around in the community, within the United States, regionally and locally, with having people be very frank with that and say, yes, we want to take care of as many people as possible. We want to heal the sick, but with certain conditions, we have to know what we can and cannot take care of. And the quicker we know that, the quicker we can figure out, okay, what's a protocol if something like a devastating stroke were to happen? Are we going to wait around for a day or two and run tests and hem and haw with the patient and the family and just kind of hope and pray it away? Or are we going to
Get
figure
in
this
there.
out quickly and immediately triage to an accepting hospital like Wellstar that could take them in and be able to initiate expert level comprehensive stroke care, like which we provide at a few hospitals here in Columbus, Ohio as well. Every city has these kind of different steps in the care level, and I'm glad that that worked on your behalf.
Who was advocating for you, Miss Juicy? Because I always believe that when you're alone, that makes a big difference, as opposed to having your own personal caregiving team, if you will, or advocate.
Well, once they got a hold of my sister, she flew down from Colorado because it was all over. Like I said,
Right.
one of the, I don't want to say, well, somebody at the hospital
Yeah.
was the
As
one that
there.
leaked
Yeah.
it,
That happens.
and to TMZ, and she found out about it Wayland, Colorado. And so she flew down. She called my mom, which is in Texas, and flew down here, and like, hey, when she found out it was so many, cause she's in the service, and so she had some other people in the service here in Georgia. She's like, go check on my sister.
Right.
And she was, when they called her and let her know, okay, it is true. But they saying that she had a heart attack, and then this other thing, the other report saying she was dead. And they was like, well, no, she's not, blah, blah, blah. And so, but they flew down, and then she told them, she's like, get her out of there. When they told them how many people was coming to the hospital and everything, she was like, get her out of there. And then they put me on what they call a broken glass thing, where you couldn't call and get no information and stuff. Because they said,
I'm sorry. You go ahead, darling. I'm sorry. Doctor, am I wrong in terms of saying about having the advocates and having those people who, when you're not able to ask the questions and to make the decisions that have to be made in terms of, well, in this case of a celebrity, and being able to get all that she needs without having to worry about all the people coming in to check on her?
Wouldn't it be great if we lived in a society where that would never be an issue?
Yeah.
Unfortunately, this is America.
Yeah.
And you do need that advocate. And unfortunately, our people, more than others, we're finally getting more and more data on how we are treated within the healthcare system. And it's not as equitable as everybody in medicine believes it to be. We just say, hey, we take care of everybody equally, don't we? Don't we? And then but when you actually look at the data, you see that that's not always the case. And I'm not saying that, again, that this case had anything to do with that, but it always helps to have an advocate. She was dealing with a stroke. She was fighting for her life. She was fighting for her own brain health. And when you're doing that, you're not, a neurological emergency, a neurological injury like a stroke. It's very rare that you're going to be able to advocate for yourself while also dealing with that. So unfortunately, we have become a culture, we've become a society that's becoming more and more lonely. So that is always a little sobering, because as you mentioned, having an advocate within healthcare, be it stroke or anything else, is critically important. And especially it's especially true when it's an emergency, as niche and nuanced as stroke care. Because again, I mentioned the 85% ischemic, 15% hemorrhagic. Well, I'd say 80% of ischemic strokes can probably be treated at an overwhelming majority of stroke hospitals.
You couldn't go to urgent care? You don't recommend urgent care?
No, not at all. But there are some hospitals that might just do just fine when it comes to the majority of these non-bleeding strokes. But if it's a bleeding stroke, or if it's a complicated ischemic stroke, there is a level of care that we call comprehensive stroke care.
Right.
And there's only a few of those around the country. It's almost like high school football or basketball, college football or basketball, and NBA or NFL. You know, there's just a small number around the country of comprehensive stroke centers. Like where I work, Riverside Methodist Hospital in Columbus,
Sure.
Wellstar has a comprehensive, shout out. Wellstar has obviously a comprehensive stroke center in Kennesaw. And those kind of facilities, amongst others, those kind of facilities have the capability of handling all kinds of strokes, and making sure that with a critical stroke like this, a patient gets to a center like that as soon as possible could be the difference between living and dying, living disability free, or with a little disability. All of this is critically important.
I do want to, and we're getting close to the end here. So, Ms. Juicy, we won't keep you too much longer. But for folks that may just be joining us, we are working with our partners at the American Heart Association as well as the American Stroke Association, and that's really where you are doing all of your fine work, Doctor, as an advocate, as a person, a spokesperson for the American Stroke Association. So, we want to thank you for all of your hard work and what you do as a vascular professional. This is Hypertension Awareness Month, the month of May, as we're coming to the end here. And we do want to talk about taking care of your health, checking your blood pressure on a daily basis, as many of us have to do or should be able to do, and the link between blood pressure and stroke. Ms. Juicy, you were taking care of yourself, or you were taking medication for this, but it wasn't doing its job according to you. Is that right?
I wasn't taking, to be honest with you, I wasn't taking it as good of a care of myself as I am now.
I bet.
I'm making sure it's nothing's gonna stop. I'm on a time.
Got it. Let me ask you this, before we run out of time, what haven't we talked about, or what's the one thing you want to leave with people, Ms. Juicy, about your situation, about what you went through, about where you are now, the whole picture? If there's one thing you wanted to leave with people and have them remember.
Just like you and Dr. Hicks said, did I get that correct?
Yes.
Hey, I got it correct. Just like you and Dr. Hicks said, make sure you check your blood pressure, take care of yourself on a regular basis. It's very important that you do this, because you never know. Anything can trigger high blood pressure. It can trigger stress. Stress is a silent killer. So please take care of yourself.
Absolutely. Doctor, and I thank you so much for sharing your story. I think it's really important that people see someone who looks like them, people that they've come to know and love on the radio and television, and know that you have conquered this and that you are still you're in the game. And
Yeah.
you are a face and you are a voice for those that may be going through this today. So thank you so much. We really appreciate that. And I have one more question for you, but I do want to remind people that you can learn the signs of the stroke. And Doc, if you could chime in on this, but you want to go to stroke.org/stroke month, stroke.org/stroke month. But tell us about FAST, Doctor.
Yes, and I would also say that May is Stroke Month as well. So it's an opportune time to have this conversation and also to check out that website. But FAST, it's an acronym. It is just a quick and easy way to remember stroke signs and symptoms. And the F is for face. If your face suddenly changes, if it gets weak, if one side is weak, if it's drooped down, that's F. A is for arm. If your arm is dragging, or if you're with somebody and they can't hold their arm up, and if they look different, you say, hold your arms up. And if one is dropping over and over, then you know that that is a stroke sign. S is for speech. If your speech suddenly changes, if you haven't had that cocktail yet, no excuse for all of a sudden your slurred speech all of a sudden comes out. You know, it's middle of the day, you've had nothing to eat or drink, there's not a reason, but all of a sudden your speech is slurred. all of a sudden it's hard to get the words out. You can't speak at all, or what you're saying is nonsensical. It's just, a word salad, basically. That
Mm-hmm.
is a stroke symptom that's serious. And the T is for time. It's not time to, Google me. It's not time to, call anybody else. If you're able to, you dial 911. You don't dial my office, you dial 911. Or as Miss Juicy did, you get somebody to dial 911. If you're unable to figure it out yourself, you get somebody that could. And it's such a blessing that she had somebody that was able to do that for her in a timely manner. But that's be fast, because our people do not get to the hospital in time when it comes to stroke, as opposed to other races and ethnicities. And therefore, because stroke is a very time-dependent disease, oftentimes the cutting-edge treatment that has been tried and true to make strokes reversible
Mm-hmm.
and to have you walk out the hospital, it's not offered as much. So you got to be proactive. You got to dial 911. We have amazing research when it comes to the hemorrhagic, the bleeding strokes that are done at the large comprehensive stroke centers, as I mentioned, like the one that I work at, where we can work to eradicate some of these strokes that are still mystifying us.
Mm-hmm.
But if you get to the hospital quick enough, if you get to a hospital that does cutting edge research like that, you could, really survive and thrive after a stroke like Miss Juicy has.
That is so awesome. I'm going to ask you both a question, Miss Juicy. You exude such vibrance and such joie de vivre, and you have such a joy in your spirit. What have you found helps you to do? What is your form of exercise or your form of action that helps you relieve the stress that you have every day? And Doctor, I want you to think about the same thing.
I pray.
You do a little praise dancing too?
And I pray, and I'm just being totally honest,
Mm-hmm.
because I'll get stressed real fast and real easy. I pray.
And
That
you work
helps
in such a high tension business too, because everything is heightened. Everybody wants you to be first and fast and
right
funny, and
now.
yeah,
Right now,
yeah.
about everything.
And prayer is how you relieve that stress.
Exactly.
Yeah,
That's exactly how I relieve it.
yeah.
Especially now, because I know it. I know I didn't get well by myself.
Mm-hmm.
It was all God. I got to give God all the praise.
There you
So
go.
I make sure I depend on God for everything.
Yeah, God bless you. Dr. Hicks, what about you? Not only the advice that you give, but what about to others as such a wonderful professional? But what about you? What do you do to relieve the stress in your life?
Well, as someone who has a history of 4 straight generations of Baptist ministers, I do understand the power of prayer, and
Yeah.
I do understand how important that is. So there's no doubt about that. Mindfulness is helpful in any way, and
Mm-hmm.
prayer helps with that. Getting good exercise, free exercise, or joining a gym and doing other sorts of clubs, whatever gets you interested in movement. There's great data behind 15 minutes of moderate intensity exercise driving down your blood pressure, driving down your risk of heart disease and stroke. So these things are critically important. And again, I've got a German Shepherd, and
Mm-hmm.
I love walking him. I love doing other sorts of things like
Do you
rowing.
walk him or does he walk you, Doc?
I had to learn early on. We had to train this one because he's 100 pounds of muscle. So yeah, if you're not careful, he'll run your life. But no, we walk together, and but if free exercise activities, keeping up with the kids, having the
Mm-hmm.
basketball hoop in the back, and just moving around. Having a rowing machine in my house. I'm not a gym person. Some people cannot get up and do it unless there are other people doing it with them.
Right.
My
Yeah.
mother's a very social person, so she likes to be active with others who like to do that as well, be it with a video or that sort of a thing. She likes that kind of interaction. My sister's the same way. My brother has a home gym in his down in his his area where he lives, where he works on this sort of stuff. So everybody has different ways of getting that exercise, and you got to do it.
Yeah.
And there are other things that drive down your risk of stroke, of course, that I'd be remiss if I didn't bring up, which is
Please.
healthy eating, Mediterranean diet. That's the way to go. The Southern-based diet, soul food, I love it. We all love it. We've got to have it in moderation. This cannot be a main staple of how we eat. Data tells us this hurts us. So we're able to implement a Mediterranean lifestyle, a vegetable-based diet, as Miss Juicy talked about. Diet is extremely important. Hydration with water. People don't think about that.
Right.
Smoking. No one understands how much we smoke in the United States. A lot of circles have not done that to the point that others have. So it's become a big discrepancy. We talked about high blood pressure. We understand diabetes and its risk with heart disease and blood vessel disease like stroke. All of these are critically important.
Doctor, you are a font of information. Are you on social media?
I am not very well, but I'm on Twitter. I think it's this handle. It's at B.J Hicks MD. I think Instagram is at BEEJAYHIX. Those are the two kind of social things that I'm on, and then of course there's LinkedIn. I think it's just my government name, as they say. William J Hicks, the Roman numeral 2 MD is the LinkedIn. That's
You're
me.
great. You're great, and you represent the HBCUs so wonderfully. Make us proud of you, Doc. We appreciate
All day,
you.
every day.
All right, and Miss Juicy, you are an absolute delight, and you are really the poster child for joy and giving joy and receiving it in return, and for one very strong woman who is living her best life and being a great example to us. Thank you so much. I love hearing you tell your story. I hope that you have the opportunity. I'm honored that you accepted our invitation to come on and talk about this today. Thank you so much. Appreciate you both. I hope we can do this again on another year-long observation of when this happened to you as we continue your journey. We appreciate it. I also want to thank the American Heart Association, the American Stroke Association, and with the American Heart Association, our friends Zach Burgess, Darcy Wallace, Brittany Glover, and of course, the woman with the biggest heart ever, Arika Kaysen. And of course, my team, I want to thank Diana Chica as well as Yolanda Starks-White, also known as Yogi. We appreciate you all. Thanks so much for joining us. God bless you and be well.